Our next presenter is going to be Laura Russell, and Laura Russell is a licensed clinical social worker. She has a bachelor's in social work and a master's degree in social work from the University of Central Florida. Laura is a qualified supervisor and able to support and mentor registered social work interns in the state of Florida. Laura started her career helping children who have experienced abuse. The last 7 years, Laura has worked with patients and their families who have chronic, terminal, and end-stage conditions on adjustments to illness and coping with the emotional impact. Laura is currently the licensed clinical social worker with Advent Health Neuromuscular Medicine in Orlando. So she works with Dr. Jareth. And Laura, I'm turning the screen over to you. You should see something come up on your screen.
Let's see. Can you hear me?
We can hear you. I think there you are.
Hello. All right. So let's see if I can share my screen. I think you did it for me last time.
Yeah, I think your screen is shared. The emotional journey of periodic paralysis is up on the screen.
You can see it. All right, great. Let's see if I can get it to presenter mode. There we go. Did that work?
It did.
All right. Thank you so much for that introduction. So like Linda said, I'm Laura Russell, and I am a clinical social worker, and I work with Dr. Jareth in our Advent Health Clinic. I'm going to kind of shift gears a little bit and get you thinking about the emotional journey that is PP. And what I mean by that is I would really like to focus on the psychosocial aspect, because we really can't treat any of these medical conditions without first, of course, focusing on our psychosocial impact that the diagnosis comes with. This will be kind of the agenda that I will go through. And if you can see, I'm going to explain first what a social worker is, because I know there's a lot of misconceptions and I want to kind of clarify that just a little bit. And then we will touch base briefly on the medical, psychosocial, and of course, that mental health impact. And then I'm going to, of course, want to touch base on coping and some of those stress management skills. So I leave you guys with a little bit of tools to kind of attack some of these different concerns that come up along the journey. And I will spend a little bit of time touching on our caregivers. They are the backbone of our healthcare, and I want to make sure I give some very strong attention to you guys. And then I would like to close with talking about how Advent Health is now responding to our PP community and what I'm going to be doing to really target you guys and make sure we are being inclusive in care. All right. So what is a social worker really? So like I said, I know there's a lot of misconceptions on what we do, and I'm a big advocate that any medical discipline should have a social worker on staff. So social workers are master's level mental health clinicians. So we are trained in understanding human behavior, and specifically social workers, we like to target the social environment. So not only do we focus on the psychological, the mental health impact, but also the environment that we live in. So when I talk about psychosocial, I mean the psychological aspect as well as the environment. So when I'm with a patient, I want to acknowledge everything that goes on in their community, as well as in their home, as well as internally. Social workers help navigate the emotional challenges that come with this diagnosis, as well as any chronic illness. We can't really treat a medical condition without considering those psychosocial and psychological impact. My philosophy is I really like to do a patient-centered focus. So when a patient comes to me and has a concern, my first question is, okay, tell me your story. we don't always need to start from the very beginning, but I want to hear what is going on with you today, yesterday, and really help formulate a strong rapport and relationship so I can know not just what's going on physically, but really what's going on internally and how has your environment been impacted by this condition. Social workers are a big facilitator to aid in a patient's self-empowerment. I strongly believe all of our patients, and anyone for that matter, has the power to really have a positive mindset and attack a lot of these conditions emotionally. And we just have to kind of dig out and find that self-resiliency that you have. And of course, social workers are big advocate for social change. I know a lot of our patients are adjusting to this disease state, targeting and educating the medical community, and it's a lot of work. So social workers really want to be in your corner and being the advocate along with you. And of course, as you know, there is a limit for resources. So social workers are always constantly researching and looking to see what is the most available resources out there and how can we really make sure we are bringing the most benefits to you guys. So that kind of is a brief synopsis of what a social worker is and what we do. I would ask that any of our medical team listening today is if you don't already have a social worker on staff or a part of the team, I highly recommend it because, like I said, we really can't treat anybody medically without acknowledging this major aspect of their care. Because if we just fix or adjust or treat that physical pain, that does nothing for the rest of their environment and how their relationships have shifted from getting this diagnosis. And we'll definitely talk about that throughout my talk today. All right, so I know Dr. Jarrett kind of touched on this briefly with the medical impact. And when I say that, I'm talking about kind of more of the social aspect of my entire talk today. It won't be really medical minded. So really the accessibility to specialists. I know Advent Health, we are taking patients from all over. We want to make sure we are targeting anybody who is in need. You can reach our office because I know there is a limit on the availability of neuromuscular physicians or medical teams that really understand PP and the components that go with it. I know a lot of you struggle with the financial piece that comes with PP. Do you still have access to insurance? Do you still need to apply for Social Security? I know that's a very big factor, and we'll touch base on that as well. I know most of my patients, one of their first things they express to me is the frustration that they have experienced during a hospital stay, most importantly, an ER visit, if they make it that far. I know one of their biggest arguments is, I'm constantly having to fight for somebody to listen to me, to hear me out. And if they do, then there's that fear of being misdiagnosed, of not being believed, or being over or under medicated. So those are some big factors that we have to make sure we are acknowledging during this process. And of course, one of the biggest challenges is finding the right medical team for you. You can have the best team of specialists, but it might not match your personality or what your goals are. So we definitely want to make sure we're acknowledging that. And there's also a limited for resources. If you live in a rural area and there isn't a specialist near you, then you have that barrier. Luckily, Advent Health, we are trying to break down that barrier and make sure we can bring access to you guys via telehealth visits. So that is just one little impact that we're trying to make. All right, so this is probably one of the most important aspects, and that's the psychosocial impact that PP has on our patients. And the actual literal breakdown for psychosocial is the psychological, which is typically your mental health disorders and such as that. The second is the social. So your social environment, your relationships, your life with work, how you cope with your natural environment, your culture. How do these aspects of your life play into your healthcare? So my big role as a social worker is to make sure I am advocating for your psychosocial connection and issues to make sure we are really targeting those losses, changes, or needs in your care. So I listed a couple here. So a change in the family role. So you may have been the breadwinner or working full time, having this high, fast paced career, and then you start getting these symptoms and it starts changing your dynamic. Fatigue, you can no longer attack work like you used to. And that comes with a lot of barriers and stress. And we want to make sure we are addressing those concerns. Um, another big one really is difficulty in mobility. So maybe you've gotten a motorized scooter. Great. But your home still isn't accessible, right? So then we have to go through that process of making sure your home is safe, accessible for you. And then you have the added layer of, well, what about the world? When I leave my house that's accessible for me, everywhere I'm going to go, is there going to be a barrier? Am I going to have to practice or plan different grocery stores or different stores I'm allowed to be in based on the access? So that is really the big impact that we see is not only do we have the concern of physically how am I getting treatment, but how has my world now adjusted with this diagnosis? Even a change in relationships, that's another major factor because relationships get impacted, whether that's your best friend doesn't understand your diagnosis and they constantly question, well, I just don't understand. And you feel the pressure to fight and impact yourself or empower yourself to be able to say, well, this is what I'm going through. And it's hard when you're constantly having to have that talk and fight for your diagnosis and explain your symptoms that are very difficult on a science level to understand. Never mind express that to somebody who doesn't really have the experience as well. So marriages get impacted, friendships, children, and it's also important to mention that we might be uncovering a genetic condition that nobody has known about. And then you start thinking, well, maybe this is something that other family members have been impacted or the other community. And you want to make sure you are making those connections so you feel safe and you have other people to talk with. Another big one that I wanted to mention is the Social Security disability. So I know we have people from all over, so this really would be pertaining to, of course, the US for my experience. But our process for SSDI is, it is borderline impossible, right? So my biggest thing is once you get the diagnosis, it's so hard to prove the other that is on Social Security. So then we have to worry about the impact of loss of income or change in job level. And that is a huge barrier that I focus on with my patients and walking through the process for SSDI and making sure I'm a big advocate for you as well. Now, the mental health impact, and I definitely want to preface this part with saying I know there is a very large stigma attached to mental health issues with PP, and I don't want to minimize the stigma that a lot of our patients have to break down because I know experiences of going to the ER, a lot of doctors or staff members might say, oh, I think this is a psychological concern. I don't think this is physical. I don't think this is an actual diagnosis, and really pushes the mental health talk. So I know that's a barrier for you guys, and I want to make sure that I'm also breaking that stigma down as well, because none of us are immune to the mental health impact of a chronic illness or a diagnosis or a mental illness without a medical condition. So it's really important that I stress this to you, that I'm not trying to minimize the difficulty you guys have to go through to say this is a real condition. It's not just psychological. But with that being said, it's also important to know that this is a side effect that can happen because of X, Y, and Z of what I just said, of everything you're fighting for. It's just natural that our body goes into overdrive and we have a mental health concern develop. And people with chronic illness are at a higher risk for developing a mental health concern because of the fight and the stressors that you guys get put under, and we all do. And I did find in my journey of really targeting mental health and PP that there is a very significant limited research out there for PP and mental health. And that's really important to note, because are we not targeting this population and making sure everyone is being cared for in their emotional state? And then that goes back to me saying, I think a social worker should be a part of everybody's team, so you're not alone in that aspect. Um, I really wanted to briefly mention the medical model versus social model. The medical model you guys are probably very familiar with. That's where our focus is on finding a cure, the research, and really making sure we can treat certain conditions. Well, now we are starting to look at the social model. And of course, myself as a social worker, I'm a little biased. I am a very, pro social model, because I want to make sure we are taking into consideration that psychosocial aspect of your life when we are talking about PP. And I'm going to read this quote because I just find it so, so beautiful. It is from the Social Model of Disability and Chronic Disease. And it said, it was from Lois Keith. Doing disability all day long can be an exhausting process. I don't mean having an impairment. In my own case, not being able to walk. I think I just messed up my screen. Sorry, guys. So I can deal with, I mean having to spend a majority of each day with a physical world which is historically designed to exclude me. And more tiring, dealing with other people's preconceptions and misconceptions on me. That is such a huge, huge quote that I think is so very important that we all embrace, because it's true. A lot of our patients with PP will be successful and adjust with this diagnosis. It is a challenging and difficult road, absolutely. But what makes things more difficult or more tiring is trying to deal with the outside world. So while I may be diagnosed with PP, right, and you get accepting to the point that I'm like, I can do this, I know my triggers, I'm prepared and planned for an attack. But what about the world around me? How will my relationships be impacted by that? How will my loved ones recognize if they feel that I'm experiencing one of these attacks? How will the ER staff treat me if I need to go for emergency care? How is my van or these restaurants or shops going to be accessible for my diagnosis? So it's not only having to cope with yourself, it's the world around you. And I think that is really what brings me to talk about the next three disorders that can often develop from this preoccupied thought of all of these different things going on in our lives. Anxiety is probably one of the biggest factors, and anxiety is going to be at some level completely normal for all of us to experience. Um, it is really, really what helps us stay on top of tasks and making sure we achieve our goals, because it keeps us focused and really keeps our heart pumping to make us really follow through with things that we need to do. The difference with actually an anxiety disorder and this normal level of stress and nervousness is when anxiety becomes so severe that it's preventing you from doing your favorite activities or daily tasks. And you have more often than not a real sense of uneasiness, distress, or dread for any of your normal activities that you have. So, for example, if you are preoccupied with your next attack or a next symptom that might happen, and you can't get out of the bed for the day, or you won't leave your house because you're just so worried something might happen, then that is something that we would want to target and really make sure we are addressing so it doesn't consume your life. We never want that. It's treatable, and we want to make sure we're addressing that. All right, and some of the big symptoms of anxiety disorders, we look at restlessness or feeling keyed up or on edge. And what that means is that's that really nervous feeling where you start getting maybe clammy hands or nervous, or your body kind of heats up and you really just can't get comfortable and you're just preoccupied with those thoughts in your mind, kind of on replay. And if you're being easily fatigued, and I know that's kind of ironic with this diagnosis because that's very common. So when I say easily fatigued, it's going to be you're just kind of emotionally exhausted from the day. So you just sit on the couch and you're like, oh, I cannot think about anything anymore. And then difficulty concentrating or your mind going blank. If you find that you are becoming so nervous or anxious that you kind of just shut things out or shut things down, or maybe put a wall barrier between you and everything else going on, then that might be something of concern as well. And then sleep disturbances is something we see with PP often as well, and with any chronic illness for that matter. So if you're having difficulty falling asleep, staying asleep, or really having that unsatisfied sleep. And this is a big concern I see with our patients with PP because a lot of these attacks really cause that nervousness of going to sleep, maybe waking up in, a paralyzed motion or having that kind of barrier. We want to make sure that we are addressing that in a psychosocial manner. And there are certainly treatment options for that. I'm not going to talk about a whole lot of treatment, but I will give some coping skills and tools for that. But of course, cognitive behavioral therapy is one of the options. And, I will love to talk more on this at a later time. And depression, which is the persistent feelings of sadness and hopelessness and a loss in interest in activities you once enjoyed. Now, we all kind of experience sad mood and difficult hardships that come and go, and that's going to be normal. Life is not easy, it's tough. So, when I mention depressive disorders, I'm really talking about the extreme. So, where maybe you once loved playing soccer or playing a computer game, and those things are no longer of interest. You don't have the motivation to want to get up and engage in your normal activities, then that might be a concern as well. If you are really feeling down on yourself or really giving yourself a hard time for these difficult challenges, and uh, I really wanted to mention the sex drive change because that's so important. We want to make sure we are treating the person holistically and targeting all different areas, especially extreme mood change. I know we can go through periods of anxiety or feeling really sad or feeling low. And we want to make sure we are targeting all of these different areas. We definitely have the diminished ability to concentrate, or we I guess a big example would be when you are kind of wanting to stay to yourself. Maybe you're not engaged in all of those activities you once enjoyed. And those are really, really important that we address all of those things because we want to make sure you have the best quality of life that you can. And that kind of brings me to PTSD. I know Linda and I both really chatted about this, and this seems to be something we see often with our patients, which is the post traumatic stress disorder. And typically, we relate this or we think of this as a wartime thing or a loss of life or something very tragic has happened. And that's absolutely true. But what I want to relate PTSD to with our patients is that medical experience. And what happens when we go to the ER and we're not being listened to, we're not being heard, and we have these periods of patients are fighting constantly for being heard or acknowledged. And that is really stressful on the patient. And that can bring back up old memories of maybe you were admitted to the hospital and you didn't feel that your care was being understood or appreciated, or you weren't being acknowledged. Later down the road, if you have to go back to the ER for more treatment or back to your medical team, and these different uncomfortable emotions come back up, and you get these flashbacks of experiences, it could even be anxiety inducing. We want to make sure that we are being careful of that, and it is definitely treatable with a licensed professional. We want to make sure we are listening to you guys in these experiences. And PTSD, of course, is in the DSM-5, which is the Diagnostical Statistical Manual of Mental Health Disorders, and that really breaks down what the symptoms are and things on that. All right, so that kind of brings me to coping with chronic illness. And we all use coping strategies at different time periods, and we might not even know we're using a coping mechanism. Some are positive, some might not be as positive as others, but they're definitely our way of using defense mechanisms and really kind of protecting ourselves. And Lazarus and Folkman are psychologists, and they really kind of, I appreciate that they broke it down into two different levels. So we have our emotional focused, which is kind of our own reduction of negative emotion to stressful events. And then we have problem focused, which tries to target our stress in a practical manner. So problem solving or actively trying to work towards managing a stressor. Now you might say, well, no problem. Problem focus seems easy. We're going to target the problem that we're experiencing and really focus on addressing those triggers that we might have for our illness, or changing the problem that we're facing, or how can we plan for an attack to occur so then I can diminish my fear or my anxiety surrounding those concerns. Well, sometimes those kind of problem solving techniques don't always work. For example, if we have a death or a loss in the family, sometimes compartmentalizing those into that kind of a category doesn't really work. We can't simply problem solve a big loss like that. Or, like I said, getting diagnosed with PP, that is a life-changing diagnosis that we really have to make sure we are addressing everything surrounding that. So that's where we kind of look at our emotional focus. How can we make sure we are reducing the negative emotions that can kind of go with it, and we can really learn to cope in a safe, happy manner. Some of us are, very good at staying in the denial phase. We're like, we're just not going to address it. We're going to keep going and ignore certain symptoms that we see so we don't seek help. Some of us avoid problems altogether, and those are coping strategies. They might not be the best healthy way, but it's certainly ways sometimes we protect ourselves. All right, so I would love to touch base on some positive coping skills and what tools I would ask that you guys try to utilize. My biggest one always is really try to find the humor in life and maybe not always take it so seriously. We want to make sure we still find joy in the simple things, laugh at ourselves when we need to. Maybe even poke a joke at it at sometimes, because it's really important we don't make everything so serious and that we really take time for ourselves. And like Dr. Jarrah said, physical activity is very important. We want to, of course, keep in mind some of the expectations that we don't want to push too much on our patients. We want to encourage activity, but as well as it's okay to rest. And that's just as important for a coping skill as well. Do a little bit of physical activity and then also be easy on yourself and allow yourself some time to rest as well. And then reading. I know a lot of us spend a lot of time focusing on our research and reading as much as we can on PP and symptoms and concerns in that sense. But I also ask that you find material that brings you joy, kind of can transport you to a different environment for a little bit and just get you focused on different things. We don't want this to consume your entire life. You are still a person and identity beyond this. And that's really important that we want to make sure we are treating in that sense. And of course, surround yourself with people you love and who love you. Find the community that really embraces your individuality and the conditions that you experience, but also will walk side by side with you and make sure that this journey is inclusive and together with you. And then, of course, we definitely cannot forget our spirituality. I know this is different for every single one of us, but I request that you guys all find what is internal to you guys and what faith or spirituality or higher power that you find comforting and really embrace that, because it's so important that we utilize a team approach with coping with life and all of the barriers that we face. All right, and stress management, which is very similar to coping, it kind of goes hand in hand. Stress management, on the other hand, is really actively working toward reducing the stressors in your life. And what I mean by that is making sure we are decreasing kind of the outside noise of life and everything that goes on with it. A lot of our patients are struggling with lifestyle change, role change, decrease in working, or maybe us continuing to participate in a demanding job, or even for some of our younger patients, our relationships at school and having to navigate growing up. And there's so many life factors that hit us really hard that it's important that we slow down and take the time to really decrease some of this outside stress. And I put 5 main things that I really thought were important because there are thousands of techniques out there. And when I work with my patients, I really try to see what will match their personality the best. What if they tried in the past that worked well? What didn't work so well? And how can we individualize our plan of care? Keeping a journal is probably one of my absolute favorites. It gives yourself a chance to write down your emotions and what you are feeling from the day and really make sure you are in tune with how you feel. So, say I'm feeling really angry today about my diagnosis or a symptom that I'm feeling that just won't go away. I want to document it in the journal and then put it away and then go back to it and allow myself the ability to process those emotions that I was feeling. And then I know Dr. Jareth said this as well, practice mindfulness. You embrace the meditation or breathing techniques. And you can use this, there's a lot of good material on Google, but you can also find YouTube videos that really kind of walk you through that meditation as well as a professional, because it's so important that you take time for yourself and really be in the moment. And then, of course, if you can start to acknowledge a lot of your trigger warnings, and this isn't necessarily trigger warnings for medical aspects, but for mental health concerns, for anxiety, or if you feel that you are experiencing some of those PTSD moments where you are having those flashbacks, I definitely want you to write down those trigger warnings and really learn to target them and kind of redirect your behavior and your thought process in that way. And sometimes, and most often, it does take a professional to aid you in that. And then crisis plan. So I know that sounds kind of silly, but if you anticipate these different crises or concerns coming up, then you can plan for how you will attack them. How will your support system jump in and help you? If your plan is to call Linda, I know that's often, and you need other referrals, definitely plan for those phone calls. Who are your top 3 people you notify when you are having a stressor and you need some assistance? Have that in place so it can ease that burden of that crisis mode. And then focus on things that bring you joy. Make sure you are still out living and enjoying all the things that life has to offer for you. And this is kind of my biggest thing that I want to express is stay involved in your healthcare. You absolutely have to be your biggest advocate. And I hate that that has to be that way because you would want your team to fight and fight and fight for you. And I know my team, we absolutely want to make sure we are treating you as a whole individual and in a very holistic approach. So, what I ask is that you be the leader of your plan of care. And what plan of care means, it's really what your goals and expectations are for your treatment. So be upfront with your provider on what your expectations are. Bring your questions when you go to that first appointment so you can make sure you have everything written down and you are prepared to have that open conversation. Stay up to date on all the latest research that you can, and I don't want you to become consumed with it because it's just a portion of your life, but I want you to make sure you are still participating in that aspect. And then, of course, continue to ask all these challenging questions. We may not always have the answer for you, but as long as they are being brought up, research can be done. We can compile all of these questions and really build the repertoire to be able to address these needs across the board. And then my biggest thing is, share your experiences with others. This can be a very isolating diagnosis, and it's important that we make sure and we all know that we're not alone in this, and that it's important that we are addressing everybody. And you can do this from getting into support groups and sharing a story. I know I love to hear the story that my patients have been experiencing so I can have a better understanding on how I can then meet the need that they have. And before I change the slide, always take the opportunity to educate others. And I know it can be very tiring, but we want to make sure any even medical professional or anybody in the community, educate any chance you get. That's why I started my slide with educating on social workers, because there's a preconception on a lot of this, and it's our responsibility that we get the word out so we can ensure all of our patients with PP are treated fairly and get the right treatment that they deserve. And then this kind of brings me to getting the right help. So number one, make sure you're being kind to yourself. Talk with your provider and your team and make sure they are the right match for you. And if it's not working, don't be afraid to say something or to seek other opinions. That's definitely important. And you have to advocate for your care. If you leave an appointment and you still have questions, maybe contact your social worker to clarify and to really partner and make sure we are reviewing that plan of care with you. And then ask for help when needed. Seek that peer-to-peer support. So join different support groups. I know, and I will talk about this towards the end, I'm going to be trying to start support groups as well, so I can make sure the patients who come in contact with our clinic definitely get that support as well. And then seek mental health treatment when necessary. Talk to your social worker, get a private counselor, see a psychologist. It's important because none of us are untouched by mental health concerns. And it's understandable that with all of these barriers and stressors that patients get put under, that one of these might develop. All right, so now we're going to shift almost completely to talk about our caregivers. I really didn't want to have this talk today without mentioning all of our caregivers. Truthfully, they are the backbone to our healthcare system. And I don't think our caregivers get the acknowledgement that they deserve, because we as a healthcare system literally couldn't function without our caregivers. And this is unpaid caregivers, paid caregivers, but really our unpaid caregivers keep us, really in business and working, because without them, there's a whole gap of care that is completely missed. And we kind of practice under the assumption there is somebody there to assist our loved ones. And some of the concerns that we see from caregivers, because remember, they are regular average people, just like our patients, just like any of us. They are not immune to mental health concerns Or I know oftentimes our caregivers kind of neglect themselves. Their focus is on our patient, which is great, but then sometimes their own care takes that backseat a little bit. And we have to acknowledge that our caregivers are also grieving a lifestyle change when these symptoms start occurring. So maybe um, we have a husband and wife, and they were getting ready to retire, and they had these big plans to travel the world. And now their life is kind of consumed with understanding these new symptoms that we are seeing. And now they are grieving what their plans were going to be, and things have shifted. It's important to acknowledge that and work through it as a partnership. And even if we look at our parents, who are the caregivers to maybe our younger population or even our older population for that matter, it's important to see how things have shifted. And I know a lot of my caregivers express frustration with, I just want to be able to have a cure out there for our loved one. Or they wonder, well, why wasn't it me that this happened to? Why was it my other family member? Or why was it my son or daughter? And those are real stressors and real concerns. And we want to make sure we acknowledge those and address them and support you the absolute best that we can. And being a caregiver can be quite isolating because you might feel the internal need to be nearby your loved one and be able to be attentive, that you start to slowly change what your normal routine used to be. So you cancel some of those, maybe bingo night or those other appointments that you used to do for fun because your life has shifted. And we want to make sure that we really focus on the dynamic of both parties involved in this care. Now, how do we care for our caregivers? I know that sounds, like, oh, you're absolutely right. How do we make sure we are keeping our caregivers healthy, well, and able to continue to do their role? Well, we want to make sure we have our caregivers practice self-care. And what self-care is where you take a couple of, minutes, hours, days for periods to yourself and do activities truly solely for you and what brings you the most comfort, whether that's sitting outside in the morning having a cup of coffee or reading a good book, going and getting your hair done. All these different little things that a lot of us think are just routine care, sometimes our caregivers really push those things to the side. We want to make sure we are continuing that. And also make sure you are taking care of yourself physically. That is so important. I think that is probably the number 3 thing that my caregivers say is, I'm not even scheduling my own appointments because we are really focused on making sure my loved one is getting all the attention they deserve. And I know that's a big barrier as well. So we want to make sure you are still taking time for your own health care, because we don't want you to kind of feel neglected in that sense and also have your body physically deteriorate as well. And then we want to make sure we um, focus on the communication between you and your loved one, because that is probably a big concern with our patients and caregivers. Our patients, I know they tell me all the time when we talk in private, how can I express the gratitude that I have for my caregiver or my partner? How do I express that I couldn't do life without them and that I'm so appreciative? So, communication is going to be so important that we practice our I statements versus you statements. And I mean to say, if you're having a bad day, say, I'm having a really hard day. When you talk to me that way, it hurts my feelings, instead of saying, you're being rude, in that kind of sense. So we want to make sure we acknowledge our emotions and we really open that dialogue so everybody can share how their emotions are impacted. And then I did write down date night, but I don't necessarily mean that in a romantic sense. It could be between an aunt and his nephew or cousins. Really make sure you are still keeping that level of relationship that you guys had prior to adding chronic illness into the household. So what were some activities you guys all enjoyed? Make sure you still find the joy in life and you continue that partnership. Don't build a wall where it's you're the caregiver, I'm the one who needs help. Really be a partnership. I know the community is now shifting caregivers to care partners, and that's actually a great way of saying that because that is really what we are. It's a partnership between two people or a family system, and we want to make sure we are doing that. All right. This is going to be kind of where I really shift to talk about what Advent Health is doing for our PP community. So like I said, I work with the Advent Health Neuromuscular Medicine Clinic with Dr. Jareth, and I am the clinical social worker for the team. And my role kind of has two different goals in mind. So number one, I am working in the clinic and I will attend all specialty clinic days. So I provide emotional support and individual counseling where needed. I make phone calls to our patients to make sure they are staying up to date on their care, and we are really making sure we are managing their stressors and keeping them emotionally supported. The second part of what my role is to talk about the Neuromuscular Powers program, which is what I am in the process of developing with Advent Health. And what POWERS stands for is our programs for outreach, wellness, education, resources, and support. And my goal is to make sure we are building our community for our neuromuscular programs through outreach. And what that is I'm going to bring to a kind of our community different webinars or in-person support groups to really target our emotional needs as well as our educational needs. So I will be hosting different programs where we have guest speakers from all over the nation that will come. So kind of like a mini conference, if you will. So we will have guest speakers. I really want to make sure we are targeting different age groups for support for PP. So that'll be in the works as well. And really learning to and helping our community navigate different resources and programs in that sense. All right, let's see. All right, so my biggest hope that you guys take away from today is that none of us are immune to emotional or psychosocial concerns, and that it is so important that we all take the time for ourselves and really listen to our bodies and acknowledge that we are on this emotional journey together. You have a team in, your back pocket. You just reach out to us and we will definitely be there to talk you through any kind of dynamic or concern that you feel there's coming up. I know a lot of us really have concerns with research in the medical aspect, but I challenge all of our medical team who is listening today to get a social worker on staff so we can treat our patients truly holistically and inclusive and make sure we acknowledge their cultural backgrounds, their emotional needs, as well as adjusting to the illness itself. It is so very important we really acknowledge everything. All right, and I think that kind of concludes my talk for today. I'm not sure if I know how to get out of this to my screen.
We'll get you out, Laura. Laura, don't worry about it. You really epitomize the motto of the PPA, you are not alone. So thank you so much.
Oh, you're so welcome. I don't have a fancy background that you guys have.
Oh, this is courtesy of Strongbridge. So thank you, Strongbridge.
Absolutely.
Thank you today. I'm going to be taking your camera away and we're going to be moving on with Dr. Bell here in just a minute.
Thank you so much.